Hi, this is Dr. Stephen Bracci, Verve Medical Cosmetics. What causes under eye bags and what are the choices in treating under eye bags? Well, first of all, the main thing that causes under eye bags is what happens with time and age, and that's the loss of supportive structures underneath the skin, namely bone, muscle, and fat. And as we lose these structures underneath the skin, we see a deepening of the curvature and often a darkening effect because of this loss of support. The other variable is that genetics plays a part. Some people are just naturally born with deeper creases than others, and their eye bag effects can show up earlier than others because of the genetic predisposition. How do we treat this? Well, we have two choices to treat these under eye areas, two major choices. One is the surgical approach, which is blepharoplasty, and then the non-surgical approach, which is mainly adding fillers to lift the skin. So the surgical approach, what is it? Surgery for under the eye or the lower lid blepharoplasty is basically removing the eye bags because it removes tissue, it cuts away tissue, repositions tissue, and makes the skin tighter and more stretched. However, whenever you do surgery for an area, such as the under eye area, it has effects on the micro blood vessels. Naturally, when you're cutting tissue and you're manipulating, it can change some of the blood supply. And this has profound effects, in my opinion, on how the skin ages. Secondly, whenever you cut skin and pull it to new positions, it doesn't look the same as it was before it was under surgery. So over time, these effects of the micro blood vessels and putting tissue to a new position can make the evidence of surgery under the eyes look more apparent. So people, in my opinion, become more surgical looking as time goes on because of the effects of these things. Secondly, let's talk about fillers for underneath the eye. What is the non-surgical approach? Well, fillers for under the eye, the rationale is to add back a support system and lift the skin back up to a more rested, natural, and original position so you look younger and natural at the same time. However, the key to this is it has to be done with a very good technical expertise. Under eye fillers often are done just very piecemeal. One of the common things that I see in my practices where people get under eye fillers and they only have had fillers in the tear trough or the crease between the eye and underneath the eye. And that crease, if you just fill it with one type of filler called hyaluronic acid fillers, the brand names like Juvederm, Restylane, it tends to look puffy, it tends to look darker, and in my opinion, doesn't look natural. When I treat the under eye area, I do so with my iris technique, and I use various fillers at different levels to treat not only their tear trough, but this mid-face, because that's affected with volume loss as time and age happen. So I use micro amounts of a soft filler underneath the eye, and that's called Bolatero. In the mid-face, I'll use a firmer filler such as Radius, and I'll lift both tissues in both areas concomitantly or at the same time to give you a natural rested appearance. So I use a combination of fillers. That's the artistry in doing this, in my opinion, the right way. So to summarize, you have two basic choices. You have the surgical choice, which is pulling tissue and stretching tissue to new positions. It is permanent, so that's a decision to make. It's not adjustable over time. The non-surgical approach, in my opinion, is much more natural looking. That gives you that lifting from underneath and not stretching and not moving, but lifting from underneath. And the advantage of that is obviously the fillers are not permanent, so they're adjustable over time and can match. The key to both of these procedures is to pick the right provider, whether it be surgical or non-surgical. You want to find a provider who does this on a full-time basis, does it every day, and has the most expertise.